So another important study that was being presented in abstract form was the long-term safety and efficacy for patients on cannabidiol for Dravet syndrome. So these were patients who had Dravet syndrome and participated in the pivotal randomized double-blind placebo-controlled trials and were able to go into the open extension. And these patients were followed for a very long period of time. And now we have that data. Their mean dose was about 22 milligrams per kilogram per day. So it was similar to what the label has for the patients that are currently being given this medication in commercial format. And once again, the side effect profile was very similar to what you saw during the pivotal trials, and nothing new did emerge from those studies. In addition, the efficacy is also maintained. So again, the median seizure reductions from baseline were similar to what we saw in the pivotal trials, and they were in the 45% range and higher for both convulsive seizures that were the primary endpoint for this study. So what we're able to show is long-term use of cannabidiol in this format is shown to still be efficacious for patients with Dravet syndrome, and no new side effects emerged after being treated for over that period of time. Specifically, this data went up to 156 weeks. And so again, very long-term data supporting the use of this medication without any new adverse events developing. I think the additional important points as far as safety and efficacy goes is this is a good study to look at long-term exposure on this medication in patients who are commonly treated with other anti-seizure medicines that are commonly given to patients with Dravet syndrome. So the three most common concurrent anti-seizure medications in this study were clobazam, valproate, and stiripentol. And that is something you're going to see. The side effect profile was not more significant because these patients were on these concomitant medications. And again, they still maintain their efficacy and safety throughout the duration of being treated on this medication in addition to those.